Are you suffering from non-healing cons which keeps on reoccurring? You tried con caps or other remedies but still it's not getting cured? Then this video is for you. Hi, I'm Dr. Sarika, practicing podiatry since past 10 years, and today I'm going to talk about most painful conditions in the feet, which is con. Now let's understand what is con and how it develops. So whenever we stand and walk, our entire body weight is passing through our feet sole. This creates certain pressure areas, that is, on certain areas of the foot we exert more pressure. Now those pressure areas depends on our foot arch pattern. For example, if someone has a flat feet, the foot rolls on the inner side of the feet, which creates more pressure on the inner border of the feet. On the contrary, if the person has the high arch, the more pressure will be coming on the outer border of the feet. Because of this continuous standing and walking friction, it creates a dead and hard skin under our feet, which is initially called as the callus. Eventually, this callus gets converted into con, which is the accumulation of the dead skin, which is very hard as like a stone as well. That's why it's very painful. As person will be continuing their standing and walking activity, this con gets more and more deeper into the tissue and it becomes more painful. So why the con reoccurs and why they are so painful? Any medical condition, it keeps on reoccurring unless and until the root cause of it getting addressed or treated. Similarly, in the con, which is happening because of whenever we are standing and walking, person is exerting more pressure on that area. That is the reason it keeps on happening. So unless and until we target that root cause, it will not get cured with any form of medicines or surgery as well. And because of our lifestyle and because of the ongoing pressure, it becomes more and more painful eventually. So what needs to be done? Here are some few important guidelines. Use cushioned footwear. That doesn't mean use soft footwear. Don't walk bare feet. That will increase your pain more. Don't use con caps. Most of the people, they opt for con caps which are available off the shelf in any pharmacy. Con cap has the salicylic acid. Acid is not skin friendly. So when it is come in contact with any tissues, not just a dead skin but even surrounding healthy tissue gets damaged. So the con which was initially smaller in size, after applying con caps, it becomes big and it damages surrounding healthy tissue as well. And once you stop using con caps, again the con redevelops. So that's why con caps are absolutely you need to avoid. Even if you apply any salicylic acid cream which is coming in contact with surrounding healthy tissues, the similar problem will happen. Avoid high heels. Most of the con happens under the forefoot. Okay, because it creates more pressure on the metatarsal hairs. When someone is using high heels, you see the more pressure will come under the forefoot. So the con will increase eventually. Avoid bathroom surgery like scraping of the con at home, which can even cause bleeding and damage it furthermore. These are just simple guidelines, but this is not the treatment. So if you have this kind of issue, definitely you should consult with the podiatrist for further treatment. So what is the best way for the treatment and to avoid the reoccurrence? Here at Podiatry Clinic, on the day 1, what we do is we analyze person's foot arches and walking pattern and find out the root cause, that is why person is exerting more pressure on certain areas of the foot. Also, after analyzing their walking pattern, we have a look at their shoes, particularly if they have used any sport shoes for their activity. That also gives a lots of clue about how is their walking pattern. Plus, if they are using a wrong type shoes or wrong size shoes, that could be the add-on factor for development of the con. After this whole analysis, we prescribe some corrective insoles or corrective footwear, which will not just help to offload the con area, but it will also help to redistribute the foot pressure. When the person tries this insoles or footwear, immediately they will experience pain relief when they walk. As we have offloaded the pressure, the con start getting better and better day by day. So that will start healing naturally. Now, to further speed up the recovery, in the follow-up visit, we will be also doing the non-surgical corn removal. It will be without any bleeding or without any anesthesia as well. As person will continue wearing those corrective insoles and footwear, the corn will stop reoccurring. So another question people ask is how long it will take to heal. Now that duration is variable for person to person, depends on how long they have the corn. Few patients we get, they have a corn since 5-10 years, means it's very chronic, so that might take little longer. Also depends on if they have applied multiple corn caps which has done more damage to the skin. In those cases also it will take long time. But after the first visit, when we offload, in initial 2 or 3 weeks also, we can see the good improvement in the corn, and which also gives us a clue that we are on right track. And the first non-surgical corn removal can be done in first 2-3 weeks of time. Even if the corn is very chronic and if there are multiple corns, approximately 3 to 4 months it takes to corn disappear. Depends that person is advising all the advices properly. Most of the female patients, they get one concern that do I have to stick to the orthotic footwear all the time? And the answer is of course not. Till your corn heals completely, you need to stick to the orthotic correction for maximum time. Once your corn is completely healed, you have to see that 80% of your routine is covered by correction or orthotic footwear. Then remaining 20%, it's your liberty, you can wear something else. But you have to see that whenever you have to stand and walk more, that time it's better to stick to the correction. For example, if you're going for a walk or if you're going to the gym, or say you're going to the mall where you're going to stand more, then definitely using a proper shoes and insoles is always more beneficial. Well, this might be little difficult to believe. Do you want to see how the offloading works? Then check out our some before after images.